So like we talked about with the assessment, when we're going into extension, the anterior portion of the proximal SCM is going to be really important to lengthen. So if you're still kind of wrapping your head around that, just go onto Google Images now and look up the SCM. Gray's Anatomy images are the ones I tend to kind of base my stuff on because they're quite accurate. Trail Guide to the Body have quite good accurate kind of diagrams as well. But if you look at the anatomy of the SCM, the anterior portion is going to have to lengthen massively with an extension, especially proximally. This can be really, really big for anyone that gets any pain into extension. So to help that, if we can get onto the anterior portion of the SCM, so it attaches like just behind the ear, and if we can just come anterior onto the front of it, literally find that tendon, and all I'm going to do is I'm just going to sink in a centimeter. I'm going to load the myotendinous junction. So again, the mentorship, we talk a lot about why the myotendinous junctions are so important. That's where I want to focus. So I'm going to load onto that tissue. I'm just going to support Sarah's head, and I'm going to get her to look up towards the ceiling, and I'm just going to guide her into the movement. And this can be a really, really important one to help restore full cervical extension. And it's one I use a lot in the clinic, to be honest, for any kind of neck patients. So that's going to be one of the positions for SCM. The other one that's really important for SCM is the ipsilateral SCM is going to have to lengthen as we look over the same side. So we talked about in the previous segment about how important like these tissues that attach onto the spinous process are for ipsilateral rotation, because the spinous processes are going the opposite way, but also the ipsilateral SCM is really, really important. So same thing, I might get onto those tissues, but I'm just going to rotate to the same side. So again, if someone's getting ipsilateral sided pain as they're looking over that side, the SCM might be a tissue that's really, really important for that. I think the key point is I'm not compressing too much, so I'm not really jabbing into that area, because again, it's quite a sensitive area. We've got a lot of the cranial nerves, we've got like, you know, lymph nodes, etc. in there, so I don't want to go in too deep, or glands, sorry, is what I meant to say. So I don't want to go in too deep, I just want to sink in, and I'm more elongating, like it's an elongating load, or I'm loading rather than compressing. So putting my load into the tissue, pushing down, and just getting Sarah to active assisted extend her neck, basically. How to
down?
Yeah, so I tend to sink in about a centimeter. I'm loading down towards your proximal attachment. Sorry, distal attachment. Sorry? That's my 2 fingers. I'm using these 2 fingers here. So I'm getting them around 2 fingers, load down, and going. You could use the thumb, but I just think it's a bit easier to get your fingers in at this point, just because it's a bit sensitive. So I'm not pressing very hard at all. It's all quite gentle, especially if someone's got neck pain, you need to kind of go really easy with this. Obviously, you can do the opposite side then as well. That makes sense? But yeah, that's a really nice one for anyone who gets any kind of extension pain with or any ipsilateral rotation pain with a neck patient.
And you push that way. Is that too much pressure? Is that alright?
So just bring my head back to neutral before I do the movement. So find the muscle first. Once you have your position, just go back into the middle. That's it. And then load down. So you're gonna elongate the tendon. That's it. You're gonna hold that load until you extend. But you just want to keep that tension all the time. So don't lose that as I extend.
Again. Is that pressure okay?
Yeah, feels good.
Would it be worth asking them if the pressure felt alright, or if it was...
Yeah, just get the feedback. How does that feel? You'll get it from anyway, you know, they'll be really tensing up if it's too much. So you'll know straight away if it's a bit too much, and if it is that, just ease off a little bit. And again, if you're in the right area, you're stressing the right end of the junction, you don't need that much pressure.
Okay.
Just like a little bit of pressure, more load than press, so press in a little bit, load a lot, and then you bring it to the result.
Okay.
Perfect. You want to try a bit into the rotation as well?
Yeah, so same load as well?
Exact same, yeah. So I'm just going to load the tendon and then just get to rotate to the same side. That's good. Nice. Good.
Nice.
Good.
Perfect.
It's a bit like we were talking about just before that the camera started rolling about how Sarah was saying like there's a lot of tissues around the neck that I consider it, and there is. Yeah. But there's some big players. The SCM is one of those really big players. I say when you're treating any necks, be really suspicious of any SCMs, any suboccipitals, your splenius capitis and cervicis, and they're the big ones really. They're the ones I'd be focusing on. Okay. Obviously, you might have to treat some other ones as well, but if you can get all of those moving well, more than likely you're going to improve the symptoms. Yeah. You might need a couple more tissues just to desensitize the last little bit. Yeah. quick recap for then for module 5, which is the neck. So how have you found this week, Sarah?
It's been good, pretty much the same as, not the same obviously, but like the same kind of structure to the previous week. So it's understanding the foundations of the upper and the lower and then adding the cycle onto that as well.
Yeah, exactly. It just follows on. It's the exact same system now.
Yeah.
So like, and the system doesn't change, which is the beauty of it. So once you've gone through module 2, 3,
Yeah.
4, and now 5, the system's the exact same. And even now when we get into some of the higher level stuff, return to play, and the exercises are going to start to look a little bit different. The concept's still the same. We're just trying to gradually improve load tolerance of certain tissues.
Yeah.
So I suppose the key points for module 5, and again we've covered some of that in these segments, but I think the big thing is upper limb. So it's very important not to forget module 3, because that's going to be important for the neck. Upper cervical is going to be really, really important. Just like the rib cage is really important for the lumbar spine, the upper cervical movement is going to be really, really important for the cervical spine. And then obviously we've got our assessment to zone in on the tissues that are particularly relevant. Yeah, and I think the key thing again with all of these is linking it back to the story. So in the ideal scenario, we're going to have history, whether it's an actual injury, a whiplash like we talked about before, or whether it's they've had an upper limb injury, or whether they've just got a stressful job, whether they get the pain, or they get pain when they're at the desk at work, when they're driving, when they're reading. Those kind of things are going to really, really point towards the neck. And then we'll have an assessment. They get pain as the neck flexing, they get pain as they're doing whatever. And then we've got our other tests then that are really helping us zone in on what tissues we need to treat.
Yeah. Is the cervical spine quite a common area that needs treating?
Yeah, definitely. And I think it goes through kind of peaks and troughs in the clinic here, but we get a lot of back pain, we get a lot of neck pain, a lot of shoulder pain. And the neck's really important to consider for any shoulders as well. So it's not just the neck. If someone's got shoulder pain, we need to consider the neck as well, because a lot of shoulder pain, even tennis elbows, a lot of that sometimes can be neural coming from the neck as well. So like, don't forget our discs, etc. We might be getting pain in the arm, we might be getting like neurological tennis elbows, carpal tunnel syndrome, all those kind of things. But the neck's really, really important to clear for that as well. Because if we don't have good neck movement, and then say we've got a disc underlying, and then we've got something that irritates that disc, like a lack of movement in the neck, that can then compress on the nerve root, which is then going to cause those ridiculous symptoms on the arm. So neck's really, really important to clear for any upper limb injury, so any shoulder pain, any neck pain. So in that perspective, it's really, really common. So that's module 5. So module 5 follows on from module 4, very, very similar. Module 6 next week is an implementation week. So this is basically taking the last 5 weeks and being able to implement it, because it's really important that we nail this first before we go into module 7 and 8, which is a higher level return to play for the lower and upper limbs. So we need to be really, really solid at our assessments, and basically sessions 1 to 3 with a patient, which is what modules 1 to 5 are, before we progress to the higher level stuff, which is module 7 and 8 and onwards. Also module 6, we go through a lot of business content, so people who do own their own businesses are on the mentorship, and mentorship is very popular with people who run their own clinics. There's a lot of business stuff they implemented there in terms of growing your business as well. So there's a lot of new content in there if you need it in terms of the business stuff, but it's really, really important for module 6 to nail the last 5 weeks before we move on to module 7 and 8.